everyone, this is Dr. Palacios and I'm here to show you the last video of this short series of heart disease. In this video, I'm going to be talking about naturopathic treatments to help you cope with heart disease in general. Okay, so without saying much, actually before we get started, again, I want to say the whole disclaimer about this only being for educational purposes. I do not intend to treat, diagnose, or replace medical treatment with the information provided. So anything that you try, it's at your own risk. And make sure you consult a qualified healthcare professional if you're trying to make changes for your typical diagnosis. Okay, so let's get started. I'm gonna talk about 5 treatments, quick treatments that you can start doing today if you happen to have heart disease. So one of them is actually a very interesting finding of how it works, specifically because it works very specific to the heart organ, and this is called Hawthorn. Hawthorn is an herb, and the full name is Crateagus oxycantha, although it's one species. There's many kinds of Crateagus species that work for the heart, and it has 3 main components. Flavonoids, these are more of the antioxidants that work, that are called, they have vitexin, rutin, and catechins, which is also present in green tea, the catechins specifically. It also has other type of acids called triterpenic acid and the phenolic or phenylcarboxylic acid, and it has been shown that it works on something called lipid peroxidation, which basically means when the LDL, the quote-unquote bad cholesterol, is causing radical damage. It's causing reactive oxygen species, which can damage the DNA. It's an antioxidant that works to remove those and eventually prevent DNA damage, and it's very specific to the heart. Any reasoning why, we don't know that, but it's just how it is. It also been shown that this herb can increase the strength of the heart. So people with congestive heart failure can benefit from it, and it's actually a very safe herb to take. In the past, a drug made from the plant Digitalis purpura, I believe, was used for congestive heart failure. However, you had to be very careful because you could overdose and lead to toxicity of this specific herb. But I wanted to go over Hawthorn because it's more safe, it works very well, and it's something to keep in the top of your mind when you think about heart disease. The next one, and this is more of a supplement combination, it's gonna be vitamin C and vitamin E. Vitamin C because it's a general antioxidant, and when you're going through some type of inflammation which is present in heart disease, you want to be able to have your body with vitamin C, because it is something that our bodies don't make as humans, even though in other mammals they can create their own vitamin C, but we need it. We need to be taking that a little bit more consistent when we have something like chronic inflammation such as heart disease. Vitamin E specifically works like the Hawthorn aspect on the lipid peroxidation, which is the free radicals of fat metabolism that can damage the arterial wall, that can eventually end up causing the plaque in the artery. So vitamin E can help reduce that. And yeah, so it's a good antioxidant because you're getting the water-soluble antioxidant, which is the vitamin C, and then the lipid or the fat-soluble antioxidant, which is vitamin E. So both will be good to have, and good to have in the top of your mind as well if you think about heart disease, especially with high cholesterol levels. The other 3 are gonna be more about lifestyle changes. So the first one that I'm going to talk about are the dietary changes. So from the previous video about allopathic treatment, the doctor is going to probably recommend you to stop eating more refined carbs, any more fried foods, and start eating more wholesome foods like fruits and vegetables and nuts, for the good fats and just the antioxidants in general. But for naturopathic treatment, we have seen that there are two types of diets that work very well for heart disease. One is called something DASH, the DASH diet, which basically works for removing sodium or reducing sodium out of the diet as much as you can, specifically for the management of high blood pressure. Although it is not necessarily the case that always sodium is correlated with high blood pressure, it is in some cases that people can have high blood pressure because of their high sodium intake. So this diet is specific to reduce sodium in general, and which will help you reduce your levels of high blood pressure. The other dietary changes that works a little bit more holistic, I think, for heart disease is the Mediterranean diet. So the Mediterranean diet, which is common in Greece, Italy, Turkey, the whole Mediterranean region, is to eat more wholesome foods like healthy poultry, also a lot of olive oil, which is very antioxidant. It's a very good fat to have. And also generally more fruits and vegetables, really. Also, the amount of carbohydrates is reduced, which could help overall for the management of heart disease. And typically it's just a healthier, cleaner diet to have. But the main things were fish, some red meat, but not a lot, some red wine. I believe it's like 1 glass a day for men and women, no more than that. Red wine, and then olive oil and a lot, dressings of olive oil on your salads. Okay, so it's also been shown to help reduce heart disease. And the other type, I believe this is from Harvard University or even the American Heart Association, is to just move a little bit. Every time that if you are at risk of heart disease or you have heart disease and you work at an office, it's recommended that you move once an hour, at least just to go to the bathroom, move a little bit, because it's very essential that your body is moving. If you get a chance to go to the gym or go for a run, 30 minutes, I believe 3 to 5 times a week, 30 minutes of cardio, like, moderate to high intensity, can definitely help reduce your risk of stroke, reduce, antioxidant levels. It can increase your antioxidant levels. So, and it's just for free. So you don't have to really be spending much money when you're talking about exercise. And they actually found that if you walk 5.5 miles a week, it can help with the reduction of heart risk. Although I do recommend that you walk a little bit more than that on a weekly basis, probably 10 miles or so. And the last one, which may not seem obvious, but it is something that we found correlates, is depression. If you have heart disease, you're also at risk of having depression, and people who have depression are at risk of having heart disease. And actually, I have two stories from a book called The Heart Speaks by a cardiologist. One of them was about a patient that she saw who she believed had, this man is going to get a heart disease. He's going to get a heart attack anytime soon because the lab levels were all over the place. And she was expecting a very big 40-year-old, a very big person, somebody who doesn't run, somebody who's just sedentary all the time, and eats a lot of bad stuff. And the moment she saw the patient, she was shocked because this patient was completely healthy. He was a runner. He went out biking almost every day, and he looked like he was 30. although his real age, I believe, was like 45 or so. She was confused as to why that was. And eventually she investigated as to why this man who looked so healthy had such a, quote unquote, bad heart. After doing some investigation, about asking him about his past, he found out that he had lost his only daughter in a car accident. The daughter was about 6 years old. 2 years ago, after this interview, she passed, and he was devastated. His wife, was telling the doctor that he wouldn't go to his daughter's room. He will avoid it at all costs. Basically saying that he was deeply hurt, but he wouldn't admit it. And ever since, he just went out biking with his friends. He went any way possible to get out of the house and do activities that would not be anything related to the daughter who passed. Unfortunately, the doctor had to tell him that, that whatever, I don't understand why this happens, but, the fact that you're not able to process the grief has probably led him to have such a bad heart, because even his diet was clean. Eventually, the gentleman went to counseling therapies. He had, the grief release. He was able to vent to the therapist, and after, many sessions of venting and crying and letting things out, his heart eventually started getting back to normal when it comes to the blood work, and how it was, the risk of heart attack, it just decreased incredibly. So again, it's not something that you hear every day, but it is, I think it's a very interesting anecdote to keep in check your emotional wellness. In the ancient medicines of China, Tibet, Ayurveda, and even the Native Americans, the heart it's the organ of emotions, the seat of emotions. So it's important to take care of that when you're, when you have risks of heart disease. If the diet is not working, if the changes in lifestyle are not working, even the medications are not doing as much, always try to see what type of emotional blockage is going on. That could do it. I'm not saying that that's the only way, but I'm definitely saying that you have to take care of that too. Okay. So that's it. I just want to mention that thank you for watching this mini series on heart disease. I hope you learned something, and I will see you for next time. Thank you so much.